Getting your teeth cleaned may infect your hip or knee replacement.
Will it though? Really? I mean, come on, what is the evidence?
We used to think that, well, let's talk about the evidence. That's what we're going to do. We're going to break it all down. We're going to let you know, is this really a thing? Do you have to worry about it? What should you do? What's your dentist going to say? Welcome to Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalz.
Okay, this is a controversial topic.
And
Changed a lot in our practice.
And it's a question we get all the time. And we've made a
Calls
video
all the
about it
time.
before. People call the office and say, I'm going to the dentist. Do I need to take antibiotics before?
Or the dentist calls, or the dentist sends a fax saying, hey, so-and-so's coming to have their teeth cleaned.
Yeah.
What's your protocol? And it goes to show how non-universal it is.
And how our office is quite archaic because we still have a fax machine.
Yes, we do.
Okay, so the question is, do I need to take antibiotics before I go to the dentist because I've had a hip or knee replacement and I don't want to get that joint infected?
And so the reason that this is even a thing is because our mouths are dirty, particularly, I was just going to do the same thing. So we have a lot of bacteria in our mouth. So when you have a dental procedure, when you have a teeth cleaning, something that's significant, that stirs up the bacteria, and often when you have these procedures, even like flossing, you get some bleeding. And once the blood is there, that means there's access to the blood vessels, so that bacteria in your mouth can go into your bloodstream, and that can cause a transient, what's called bacteremia, or bacteria in your blood. And then theoretically, that could cause septicemia, where you actually get sick from this. This is very, very, very rare. But as those bacteria are circulating down the arterial paths, when they go to your implant, most of the parts of our body have good blood supplies to defend themselves from bacteria. They can gobble them up and get rid of them. But the implant does not have an inherent blood supply, so it is at risk of bacteria kind of being deposited onto it. And then that sometimes can lead to propagation of these bacteria, leading to an abscess or a frank infection that has very severe consequences. And we can link some of our other videos where we talk about this. There are treatments for them, but this is catastrophic for both the surgeon and the patient.
Thank you, Professor from Gilligans Island.
There you go.
How is Ginger?
She's not bad.
Okay.
Not bad.
So, and one of you might have picked up what Dr. Wiening said, even flossing your teeth or brushing your teeth vigorously can give you this transient bacteremia.
Or even not brushing your teeth can also do this, because you could end up with a dental abscess or an infected wisdom tooth. Anything where there's more bacteria in your mouth goes to your blood, your implants are theoretically at risk.
Right? So then you should be asking, well, should I take an antibiotic before I floss vigorously or brush my teeth?
That's a good point.
So
no is the answer, just in case you stop watching right now.
So we look at the literature to get these answers, and we look towards guidelines from governing bodies and working groups and things like that.
Sure.
And so before probably 2012-ish, we said, every time you go to the dentist, if you've had an artificial joint, you should take an antibiotic.
Forever.
Your dentist should prescribe you, 1 pill or 5 pills or a few pills before and after your dental procedure.
Yes.
Okay. Now, what's the problem with just taking antibiotics willy-nilly?
So in the short term, not much. But what I would say is that any antibiotics that you take that are not necessary, we're learning more and more that it actually can disrupt your gut microbiome. That would be, for me nowadays, is even a bigger one, but microbial resistance. So when you take incomplete courses of antibiotics or get exposed to multiple antibiotics, eventually some of those bacteria can survive. And just like a weed that gets selected for with a herbicide, then all of a sudden that one can just propagate, and then your antibiotics don't work anymore.
Right. So taking the antibiotic it does not have zero consequence. There is a risk associated
it's not totally
with
benign.
it. A risk to public and global health,
Yep.
and a risk to yourself because it affects your gut.
Yes.
So we always look at risk-benefit ratio.
Yes.
And so the benefit of taking the antibiotic, presumably, is to prevent the infection.
Agreed.
Okay? However, if the risk is high and the benefit's low, then we say don't do it.
Right.
So that's what we're trying to establish here with whether or not you should take an antibiotic when you go to the dentist.
Okay.
And it turns out that in the literature, if you look at all the studies, there's no really good conclusive evidence that says, yes, you should take an antibiotic before you go to the dentist if you've had a hip or knee replacement.
Right, so what's lacking is good randomized, placebo, double-blind controlled trials, which you talk about are the gold standard, where there's long-term follow-up, and you essentially had one group that goes and brushes their teeth and has dental treatments without antibiotics, and one that does, and that this group has more infections than the other. This is not a study that's been done, like so much of medicine, unfortunately.
And the incidence of infection after going to the dentist is very, very, very low.
Right.
Okay, so that's the signal you're looking for when you do a scientific study. It's very low. There's a lot of noise. However, if it does happen to you, it's very, very, very bad.
Right.
So that's why it's so hard to study, because you'd need millions of patients
Yep.
to get enough infections
Followed for
for
years
long
and
enough
years
time
and years. Yeah,
to see if it's worth it.
not
That's why
practical.
there's no good answer in the literature.
right.
So
And would you say, from your practice on a separate note, thankfully, you get like 1 or 2 infections in your practice like a year. And even asking those people, they don't specifically say, oh, I just had my teeth cleaned
Yes.
or whatever. Sometimes they've had a urinary tract infection, or they've had bad pneumonia or some other identifiable source. But a lot of times there's just no identifiable cause, because bacteria are everywhere.
Okay. So having said that, we turn to governing bodies,
Yep.
working groups. And one big group that looks at evidence a lot to come up with recommendations is the American Academy of Orthopedic Surgeons, the AAOS.
AOS.
And in 2012, they came out with their guidelines on this, and they said, because before that, we were always giving people antibiotics when they went to the dentist.
Yep.
Their first recommendation was, hey, you should think about not doing that.
Right. Time to consider the evidence. Hey, we're evidence-based practitioners. Maybe we shouldn't be doing this.
Yeah, because they said the evidence out there is limited.
Limited.
And in fact, they called it limited evidence to suggest not doing it.
Right.
They also suggested that patient input should be
Considered.
a
Yeah.
lot. So they're basically saying, look, you are in charge of your own health, like we say all the time, and it's up to you, the patient, if you want to take antibiotics before you go to the dentist, because there's not enough good science for us to make a good recommendation.
Which I think is tricky, because then my patients are going to say to me, well, what do you think?
What do you think?
They're going to put it back on. Well, you're the doctor. What do you think?
Okay, so what do you think?
So I'm in a state of flux right now, to be honest. So like you, I used to prescribe it all the time.
Yes, we
My
did.
policy right now
We
is...
even made a video that said, yeah, take it.
Yes.
a few
Is
years
the
ago.
first thing is, before we get to antibiotics, don't have a dental cleaning for 3 months after you've had your procedure.
Absolutely, I agree with that.
Okay.
There's no evidence to support that.
No.
But that's what we say.
That's right.
Wait at least 3 months, because it makes sense.
Right, because your implant's just kind of getting in there and kind of getting into a steady state. We don't want to kind of stress it. So mine is, I tell people now I'm 1 year, and that's not based on any science. It's just, for me, it makes me a little more comfortable that everything's going okay for the first little bit. And then the other group of people, I'd say if someone has a very, very high risk of getting an infection, so particularly poorly controlled diabetics or people that have had a previous joint replacement infection, those people are probably going to be on it for life. That's my answer.
All right.
My patients, if you're watching, that's the answer as of 2024.
I used to say, yes, everyone should take it.
Yep.
Then I switched to no, don't. There's no evidence to support doing it.
Yep.
And I think my new position
Yes.
is it's up to you.
Okay.
If you have had a joint infection before, or you have some kind of immune compromised state because you're on some immune compromising medication for your rheumatoid arthritis or something
Kidney
like
transplant or whatever.
that, spleen's been taken out,
Yep.
or if you have been told, yes, you have an immune compromised state, then you should consider taking it, okay? However, in general, the average person, in my opinion, doesn't need to take antibiotics when they go to the dentist, not even in the first year.
And I'd say that's the trend.
And ultimately, it's up to you. Now, who's going to write that script if you do want it? Your dentist. Because we do so many joint replacements, we can't, follow, over every year after year after year, someone who had their
5,000
joint.
antibiotic.
Yeah, 10 years ago, I was
too
going to say I
much.
need an antibiotic prescription. You're not going to get it in time, because
No.
I don't know when your dental cleaning is and all
Not
that
enough
stuff.
time.
You won't get there. Your dentist does know you. Your dentist does take a medical history.
Sorry, dentist.
We don't have a lot of dentists that watch our channel.
That's right.
So your dentist
Are
is
you
right there.
I think you're an anti-dentite.
Okay, Jerry Seinfeld. I think that your dentist should write your prescription for you.
I think that's reasonable. And so that's important. We really felt this is an important topic, and because it is changing, we wanted to get this information out there, specifically to our patients, but also to our general population, a lot of which have had joint replacements. So if you have had one, if you've had a joint infection, leave a story. If your dentist has a specific policy about antibiotics, leave a message. And if you like this video,
Or even your opinion.
Or just leave your opinion.
Because it's up to you. The recommendations, the guidelines say it's up to the patient. So it's up to you. Let us know what you think.
There you go.
And
If you like this video, please like it, subscribe to our channel.
and if you do phone the office, our staff is probably going to tell you to watch this video.
Yes. Oh, yeah. There you go. Now you know.
Remember, you are in charge of your own health, and you're in charge of whether or not you take antibiotics before you go to the dentist.
We'll see you next time.